go and view them. So first, let's do introductions for everyone once again, and then we will give an overview about what we do, what type of projects we support, and how this summer program will be. And last year was virtual, it will be similar, and we will explain those kind of things as well today. So let me introduce myself and let Dan introduce, and others can introduce themselves. My name is Dr. Karthikeyan Umapathy. I go by Karthik. I'm an associate professor in School of Computing and one of the director for this Florida Data Science for Social Good program. Dan?
Yeah, I'm Dan Richard, and I'm also an associate professor in the Department of Psychology, and also direct our Center for Community-Based Learning, and I'm the co-director of this Florida Data Science for Social Good program.
Okay, good. And we would like to hear a quick introduction from others too. And Laurie, Eric, you guys introduce yourself, but you can again do it once again, then then we can get started. And
Sure.
yeah.
My name is Eric Forrestal. I'm the Chief Operations Officer at Barnabas Center.
And I'm Lori Bolello with UF Health Jacksonville.
Thank you. Wanda?
I'm Wanda Lanier. I'm the CEO of Barnabas Center in Nassau County, and we're a major healthcare provider.
Okay.
Hi, Wanda.
Hi, Lori.
So we have the healthcare as the theme, and it is in a way many of the projects we deal with one or other way will always have health connections to it. So that's something we kind of learned that many times when you work with nonprofit, that is always that connection there. Yeah. All right, so we call this for data science for social good. This concept of data science for social good has been around. It started by University of Chicago around 2013. Those who started there was no longer with the University of Chicago. It doesn't exist anymore there. They moved on, but many other universities started doing it. University of Washington does. In Atlanta, Georgia Tech used to do, but they don't. Then University of Virginia does it kind of bit different. Iowa State does it a little bit different. So, and there's universities in Canada, universities in UK, some other European universities are also doing it. It's like bit and pieces, different universities do in slightly different way, but there is a core of people now started thinking like this, and there are Stanford, Berkeley, they're also starting to doing these things like this. We started doing this in 2016 onwards with a nonprofit center provided us the seed money to do the first year. So that's where we got started. So what do we do over the summer? It's a 12-week program. We essentially work with nonprofits who already have a data, but then they have some questions to ask on the data, and they want the analysis to be done and insight to be extracted. So in that sense, we are not going to do new data collection, but if there are publicly accessible data that is there, that is relevant, we would be trying to tap into that and use along with the internal data that you may have. And we work with you to figure out what is the right question to ask, keeping in mind that these things are going to change as we learn more about the data, as we learn more about the processes you use to collect the data. All of those we get to know. Those target thing will kind of change, but we try to keep your goal and the missions in the mind and pick the right ones to work with. So let's explain this through examples. So first year, one of the project we worked with was for Yoga for Change. I'm assuming that's an organization by now everyone would know, but at that point, no one knew about Yoga for Change. It was just one person, Catherine Thomas, doing it. And her data collection was collecting data in a postcard. So what she does is yoga for therapy. She uses yoga as a therapy method to increase the mood and reduce the stress of the people. So the logic here is if people mood is higher, stress is low, and wherever they're receiving the services, so they are going through substance abuse issue and they are receiving services at Gateway Center, then if their mood is high, stress is low, they should be a good recipient and there will be impact on the services rendered on them. So, but they've been collecting data on a postcard. Before the therapy section, what's your mood, what's the stress level in a scale of 1 to 10? And after the therapy section, what is the mood and what is the stress level? And they came up with a stack of cards to us, then tried to dump to us the cards and ask us to figure out. And obviously, our reaction, like, nope, that's not what we're signing up for. If you are able to get those data into Excel sheet, then it's something we could consider. And we talked like this in March and we gave her 2 months and she did that. And over the summer, we essentially analyzed the data she had collected we sliced the data in different population groups and in a lot of different ways to see whether or not is there a difference between the pre and the post data that has been recorded. Well, while the data collection process has validity questions, we couldn't statistically prove that there is an impact, but we were able to tell a story that there is an impact, there is a differences going on. This yoga for therapy is making quote unquote difference in the data that they've been collected, which allowed them to now go after a more an established researcher from Boston and prove those differences more in a stringent data collection process wise, statistical wise, which helped them get more funding, which now they are kind of a national movement, big organization. But that happened in 2016-17 time period. And we find other options for them to work with them, continue to work with them through other means that's available within UNF to allow them to collect data using appropriate systems too. So those are the byproduct after the DSSG work. So that's one example of these simple, small company, simple data, but we were able to figure out over those 12-week time period the impact we could make for them. That's one example of it. Other example is feeding Northeast Florida. So this was in the year 2019, we worked with them. So as you know, they kind of have a warehouse and they work with a lot of different partners and agencies around the 8 counties around us. So one of the big problem for them is they have to constantly write grants and they have to find the right opportunity to write grants and they have to do the right ask in the grants. So for example, in Palm Coast, they need to write the grant to get a refrigerated van. They need right set of data to prove that that is the need and how many people will be impacted by that and what will be the food tonnage and what type of food they would need to store, all of those kind of information they need. But they have data. The data was not organized, and there was no ways for them to pull information in that level. So there are a lot of information about the agencies, partners, what type of food they distribute. So information, receive and distribute kind of thing. So we developed a Tableau dashboard where they will be able to feed in the data to it, and they can see things as a geographical system, and they can filter the data in different ways using demographic information, question information type of the thing, which allows them to now ask different questions they want to ask depending on the situations that they will be facing in. So that is more like using the data, but develop a data product that allows them to be more flexible and really have better insights through their data. But it is not designed to one type of insight. It's defined, they get to filter and define what they were trying to look at it. So that was kind of a dashboard building type of project. So again, it is data science, but it's not purely analysis type. So that's why I was giving that as an example. And the other example would be family support services. So as you may know, they work with a lot of different foster age organization who are providing a lot of support for the children who are in the adoption system, as well as the parents who need support too. They had one major funding, government-based funding, through which they have been providing a lot of different services. That funding was going to go away. So they wanted us to come and look into the data, figure out what is going on, what type of services, who are the service recipients in regards to over the years using that funding they have provided, so that they can strategize how can they continue to serve that type of recipient agencies and population and continue to provide that service. So it's similarly, we build a dashboard, but it was more of different type of visualizations needed to be created that allowed their executive team to really have a good insight into what they've been doing, so that now they can, as organizations, strategize how they can go forward to support those individuals and those partners going forward when the grant runs out of the event. So it's a little bit more focused type of activity is this example of it. We had worked with Mayo Clinic, we had worked with Baptist Health. Also before in Mayo Clinic, we kind of developed a dashboard type of system for them to look into the data that they had for a very specific program. For Baptist Health, they have a partnership with Y Healthy Living Centers. We essentially again looked into the data of those individuals who are in Baptist and partnered with Y centers and what's going on with that population of the individuals who are working with them. Right, so it was more of an analysis project for that project. So those are the different type of project. Hopefully that provides the idea into what we do in a very generic sense. We can now give an overview about the application process, and then we will open up to any questions you will have. Application process is there is a survey form kind of thing where we ask you to explain what is you're proposing. In the proposal, we kind of asking you to explain kind of the problem you are trying to deal with. That problem could be you describing kind of the social issue part, data issue you may be dealing with it. And then we ask, what is the data that you have? It may be internal, it may be external data, whatever the data that you may currently have, you think it's relevant to it, that would be another important thing. We do expect at least one person in your organization to be in touch with us throughout the summer, June, July, August month. We would like to know who that person would be. We would be asking you to list that person name in it. And we will also like to know whether there is an organization-wide support to do something like this, because it's 12-week. We run this program in a way that we try not to fail in a project. That means we want to give you something that you will be able to use. even though it may not be the one that we initially thought we may be able to give you. So one or other way, we would be trying to add a value, and that value will be negotiated over the time, but we try not to be an empty-handed thing for you at the end. So in that sense, that organization-wide support and one person being closely involved with us over the summer is kind of critical for us to make those kind of decisions calls. So our funding is limited. Funding is essentially used to support the students who will be working with us. They will be paid part-time stipend to work with us over those 3 months. The funding is essentially used for this, just for that. It is not used for paying for me or Dan's time spent on this. It's purely entirely used for, or goes to the students. Because of the limitations, we may be able to only support 3 or 4 every summer. And so that was a long-winded explanation of things. Dan, you can add anything you want to add, and
Yeah.
after that, we are open for any questions you guys may have.
Yeah. So you may be thinking, do we have something that we can submit? What are the sort of requirements? So we do look for, organizations that are trying to address what we call a wicked problem. And what this means is that it's a problem that is not solved by one organization, right? And so for Feeding Northeast Florida, they were not trying to solve the problem of Feeding Northeast Florida. That was part of it, but they're really dealing with hunger, right? And they're trying to address the problem of hunger for vulnerable populations. So we kind of look for that and prefer and tend to give preference to projects that have that social good connection, that's not just trying to deal with, say, an operational problem within the organization, but sometimes those operational problems then impact the community. And so that's what we are asking for you to think about as you prepare your application is, okay, what are we working on and how is this going to address the needs for the mission of our organization, and think about it more broadly. And we also look for projects that have some data that's available. As Karthik mentioned, you don't have to have all of your, all the data has to come from within your organization. We will work with you and are willing to meet with organizations to talk through, scope the project, something that can be done within 12 weeks, and look for any publicly available data that can support the questions that you have about your data. And so sometimes we can find things that are available. Sometimes it's more difficult. The questions you have really rely on the data that you have on hand within your organization. So I think it's a great time for the organization to meet together with the leadership and talk about, what data do you have? What data are you collecting? How much of that data do you have? Over how many years? What information would be relevant to try to answer the questions that you have? And we try to support projects that really help organizations take that next step to support their decision process within their organization. And so we know that no summer project is going to completely transform an organization, but it is a step in a process, right? So there's no silver bullet, there's no like one pill, one program that's going to completely change everything for the organization. But we do think about how this type of analysis and decision support would serve to help the organization take the next step in their journey, right? Take the next step in their developmental process. So in some cases, when we've worked with organizations, projects that we haven't selected would be projects where either there's that the data they have doesn't necessarily answer the questions that they have. And so they need a data infrastructure type project, right? They don't need us to do analysis of data they already have, but they need some help building the infrastructure to collect the data that's going to help them make the right decisions. So that's a different kind of project. And then organizations that are where the questions that they have don't necessarily match up with the data that they have, right? So they have good questions. This is really good questions to ask. It's really important for the community, but there's just no supporting data that we can connect to that to be able to provide some insights over the 12-week program. So, you know, a lot of what we try to do is if you submit an application, we will meet with organizations, talk through their application, get an understanding of the scoping of the project before we make a decision about which projects are selected. So it's not always the largest organization or the one that has the most data, but the one where there's a good fit for the summer program and a good fit for the organization for what they're trying to do next. So those tend to be the projects that are most successful and the ones that we would more likely support over the summer. So that should give you all some sense of the things that we're looking for in an application, the things that we're considering and thinking about as we move forward, and a bit about the process where we do have that opportunity to discuss, interview the potential partners and find out more about what their questions are, what data they have, what the eventual product would look like and what's possible over a 12-week timeframe. So we're open to any questions you might have. We can provide some context, some further examples and that sort of thing.
And if you don't have questions, you can also talk to us about what you guys been thinking, and we can help you guys to make that give suggestions of what you should be doing, writing or saying in the proposal to make your proposal stronger too.
Yeah, so just for some added context, last year, Lori, Eric, and Wanda, a couple of organizations did describe what they were thinking about doing. So if you have those questions now, it's definitely a perfect time to ask them. So we invite you to come off mute and share what you're thinking about.
This is Wanda. Eric, do you want to talk about the project we're considering about with the healthcare data and the hospital utilization?
Yeah, absolutely. So you're referencing the one that Jesse's been spearheading?
Right. We've been collecting data for what I think is years.
Mm-hmm.
Yes, that one.
Yeah, so we have a partnership with Baptist Health, and obviously because we're community focused in our healthcare, the idea is to keep folks out of the hospital. And so we're trying to generate a report that kind of illustrates our impact on ED utilization and hospitalizations. And so a big piece of that really is focusing on what constitutes care. So how many visits with Barnabas is appropriate to really kind of look at the linkage or the correlation, I'm sorry, between ED utilization and hospitalization. And so we have a massive data set, and we're really trying to kind of figure out what the statistical linkage is between, you know, those two outcomes.
Okay. So in your data collection, how many years you guys been doing?
I would say about,
1 year.
I would defer to Wanda, but I think our partnership with Baptist has been around for quite a number of years.
Yeah, I think it's at least 5 years of data.
Okay, good. And it contains the individual demographics, number of times they would have visited, and type of the services rendered to them and things like that.
That's correct.
Okay, good. Yeah, I think that would fit. That this is definitely would have enough data to do analysis. And we will, as we would be interviewing to you guys, we will be looking for, okay, what else we could do? A statistical analysis would be another one, but what are the other ways that this data would help your organization? And we will be trying to expand what you may be writing as in the proposal so that we dive more into this uh, the work we do, the data insights we generate is creating an impact for you. So that's the exploration we will be doing when we are interviewing, kind of talking with you guys after looking at your proposal. That's where we will be diving into. But right now, I would say it does look like you may have sufficient data to definitely do an analysis over it. Dan, anything on correlation aspects?
Yeah, I would take a look at on our website, the presentation that we did for Baptist Health for their healthy living centers. I think that'll give you a sense of, how we're connecting like the health issue with client data and kind of, working through that whole process, or kind of give an example of what that might look like. And if the question is connecting the services that your organization is providing and hospitalization utilization, then maybe start thinking about what data do you have from the hospitals,
Yeah.
and is it possible to connect your user data, the services provided, things like that, the number of times the patients have been with you and how much support you've provided for them? Can you connect that information to the actual patient hospital data, which can sometimes be difficult? One thing that we have found as we've worked with different organizations is sometimes the data exists, but getting access to the data requires agreements with the different parties. And so sometimes the organizations that we work with have already gone through data agreement process with their participating organizations, so their collaborative organizations. They already have a data sharing agreement in place, and that makes things very smooth for us because we can gain access to the data. Other organizations, those agreements have to be negotiated each time. Like every time they try to access the data, they have to negotiate that agreement again and to specify the parameters and what information is being released. So that's something to think about for your organization. Do you already have those agreements in place? Is it something that you can start working on now to gain access to that data and have those things in place? So that way, when we start in the summer, we are not spending the time trying to resolve the data access issues, and we can focus on just simply the analysis and demonstration and tool development of the work. And we try to have data in hand once the summer starts. So that can sometimes be a delay, and we try to avoid that as much as possible. So any work you can do ahead of time, making sure that those that participating organizations are sharing data, that you have those agreements in place, can really speed things along.
Those are great suggestions. Thank you. And I did have a question about your timelines. So do you operate with a fixed timeline, or is this you're seeing a project through to completion?
Yeah, so it will be those June, July, August months only, 12 weeks starting first week of June. We meet with the student interns Monday, Tuesday, Wednesdays, 9 a.m. to 1 p.m. And we will be scheduling every other week a meeting with you guys during those 3 months time period. Those meetings would be about 1 hour, and it will be between a particular date and time during Monday, Tuesday, Wednesday, 9 a.m. to 1 p.m. And those kind of things, exact date, time when we will be regularly meeting with you on a bi-weekly fashion, we will be deciding that during that first week of June with you.
Okay.
And we will be asking you to bring your calendar, and we will have our calendars ready. Interns will have their calendars ready, and we jot down in a way that when we are meeting with you, we are not meeting with the other clients and things like that. It's a process, but the scheduling is something we know that you don't do it right away. And if you wait for the week 6 to do the week 8 meeting, it's not going to work out. So we try to schedule all the meetings that needs to be done for those rest of the 11 weeks on the week 1.
Okay.
But yeah, it will be fixed ahead so that you are able to now plan along the side with it.
And we planned for that public presentation to happen in August. So we do a public, this past year, we did a virtual public presentation through YouTube Live. And so we're planning that again for this year, is to do that virtual presentation. But so we'll have some conclusions and some results by the end of the summer, by that August timeline. And we sometimes take a little bit more time to get the final report to the community partner that kind of gives more detail about the analysis done, the methodology, and so that you have kind of more materials to support the conclusions. But the presentation, we not only provide that in a public space, but also provide that presentation and the visualizations and the products to the community partners as quickly as possible around that August timeframe.
Eric, is that I don't know whether that's what you had in the mind. If
Yeah, absolutely. Right.
Something. Yeah, and we planning ahead on week 1 itself. We know always many people like to travel during the first week of August time period. You knowing ahead of it allows you to do your other planning of your you have to take care of kids, family, and all of those things. So we doing very early in early June allows gives that little bit flexibility for you to do those things. And obviously that 1 hour, you still have to find time to join us that 1 week if you are traveling during time period. Everything will be online this summer. So all of the client meetings we will have with you guys will be via Zoom.
Okay. And I had one other question. I'm sorry. I hope I'm not monopolizing the time.
Go ahead. Yeah.
So we have another pretty major project going on, and I wanted to see if this might be outside of the scope or breadth of what you're trying to accomplish. So we've got tremendous amount of data, and we're currently using separate systems, and so we're trying to integrate to one system, just a single database. And so a big part of that with the implementation is kind of scrubbing our data to make sure that we're importing clean data. Is that too big of a project for something that you typically have worked with in the past?
It is kind of relevant, but it is different type of project. So working with cleaning the data, transforming and loading into something else is a data science project. Mm-hmm. But the impact is a bit different in here, right? It is not an obvious one. It is not a good storytelling type of project. Right. It's more of, it's a data infrastructure type of project. So that's the way we feel like the impact of this second one idea is a bit more different from the first one, but it is still a data science project, right? So that's how we will see it. You are allowed to submit more than one, right, proposal, and we may end up picking one. We may talk about both during the interview, but we may end up picking one. The other reasons for us is we not only recruit students from computing, we recruit students from statistics, social science, public health, all of those things. And we kind of do this collaborative problem solving where we want those computing person work with the public health person and statistician working with social science person. So things like that cross breeding of those discipline is one of the key element for it. Like quite obviously, right, I don't know about the public health domain, but we go and get those domain expertise to solve our problem, which will include other UNF faculties, local industry, working data scientists, we go and tap into many different resources. All of them are coming in volunteer work wise. So we look for projects that is in that nature. So in that sense, if it is something purely technical only type of project, the social side is getting minimized. We try to shy away from those kind of things. But it is always good to submit the proposal. Then after looking at it, we may know the other ways to support the project and those ideas. And it may not be us, it may be some other local organization. You talking with them to look into those may be a good idea. So if we may provide you recommendation, advice, if we are not able to, if it is not right for us, we may point you in the right direction.
Okay, wonderful.
So we have a project, I'm not sure if it fits or not. So UF Health is sort of forming this entity called the Urban Health Alliance. And it's really partnering with our community partners, social services partners, and other health partners to trying to address the social determinants of health that impact people's outcomes and people's health.
Okay.
So one of the things we're trying to do is do a deep dive on the demographics and health issues and social determinants issues within Duval County, preferably by zip code, even smaller if possible. And so we're like going through Florida Department of Health, the census, the hospital discharge database, trying to pull all these things together and make sense of it all. And I'm hoping to do like a dashboard so we can say in zip code 32209, this is the demographics. The main issue is they have a high rate of diabetes, hospitalizations or deaths. You know, how can we sort of visualize and picture this versus us, you know, pulling all this stuff from all these different sources and trying to make sense of it all.
Gotcha. Yeah, I think this is also a very relevant project. Yeah, this is definitely, as you kind of already thinking, yeah, it will be a Tableau type of nice visualization project. So Laurie, I'm assuming, are you already relying on that Florida charts data available from the Florida chart site?
So we use Florida charts a lot, and you can get a lot of zip code data from them, but it's tedious. I mean, to do like we just did a health zone 1 with like what 6, 7 zip codes, and it took many hours to just pull together a table of health zone 1 demographics and key health issues, and it's like this must be a better way to do this than spending expensive people's time doing this.
Yeah, this is where we see a lot of other value added. It's not only going to add value to you. I see that if we are able to develop a dashboard and make it public, it add values to other researchers just in UNF, other public health researchers in UNF can also benefit a whole lot from it.
And we want to make it public for our partners too. So, you know, one of the things that we've been doing a lot is submitting grants with different partners. We just submitted one with Ability Housing, and we're looking at one with Healthy Start. So trying to have them have access to this data. Right now they ask for it. We spend hours trying to pull it together, and then we, you know, submit the grant. So it's just becoming a burden, you know, staff-wise.
I see. Yeah, I think there is going to be some questions on pieces of data being connecting it because of, as you can already mentioning it, all the data are collected for different purpose. Its mission is different and sliced different. Zip code will be one of them, census tract will be one of them. Navigating that is going to be a challenge, which is what we look for those now those who are working on the data, really writing the code. That's the challenge we want them to work with. Then on the social determinant side is the other challenge will come from, where we would be tapping into those other domain expertise, which will include you, as well as we will go after our UNF researchers in College of Health who are very much focused on the social determinants side to come in and give us the other side of variables that we need to focus, other data that are there uh, to broaden up and figure out what should be the right visualization, what should be the right filtering options we need to keep into the play here, and then building a system that is that's easier to ask questions to is what we will be focusing on projects like this.
Yeah, there's other
So in that
databases
sense,
we know of out there that we haven't even touched, like the Nielsen data or this was it Claritas data, mainly because you have to pay for this, and so we don't want to pay for it, but just
yeah.
expand our horizons a little bit too from what we normally just go to this site, that site kind of thing too.
Yeah, and I was going to ask about the Department of Health. You already have existing relationship. They have more data that is accessible too. And yeah, through you, we will be, if anything we need to deal with, we wouldn't directly ask them, but we will be asking you to tap into those things. Yeah, based on what you said, definitely, I would say this is also definitely kind of the projects we go after.
Good, because we've been, like I said, it's been taking a lot of time and effort and not very fruitful at times.
Yeah, this is where it's not just the technical problem, it's the domain problem too. You probably understand the domain and your folks also understand the technical side of it, but it's just that we need a bunch of people who don't do anything else for a few weeks, just work on this to crack that and develop that what we call this for problems like this, the data science pipeline, where the data can be fed and the other side we get the data in a way that is usable.
That'd be great. Excellent.
All right. So yeah, we would definitely encourage you guys to submit the proposal. And our website, if we go through the program menu, you will see past programs, and you guys definitely we encourage you to watch the videos that are there, and you will see what is the visual, what is the end product, what is the storytelling we do at the end, which are all very important thing. Vanda, Eric, there is project for starting point healthcare. It's relevant, uh, kind of very different from your end, but looking into those kind of thing, the storytelling piece is irrelevant there. Not the database, not the goal piece, but telling what you do as an impact so that those partners knows what is the value you are adding to the ecosystem that you are living in is an important piece in the storytelling wise. Oh, sorry, lawnmower. Sorry, right now in my home. And there is the children support services. I'm getting the name wrong now. From Palm Beach, that they're also relevant project. And Laurie, your project is a bit different. Feeding Northeast type of dashboard building is what we will be looking for you, which involved us building a pipeline of data that merges from different things to create different sheet. So yeah, you're looking into that project may give you a good idea of what type of visuals we would be creating for your scenario.
Good. Thank you.
And I'll make sure to send out those links after the call so everybody has access to make sure that you have that application link as well as that site that's hosted on the unf.edu website.
So if you guys looked already into our application things, and as you work with the application, working on the proposal thing, if you have any questions, feel free to email us, and we will do our best to get back to you on time for it.
And what is the deadline for the application?
It's as of now, it's March 19th, 5 p.m. We
Okay.
most often we don't want you to lay on it. If sometimes if we feel like extending and giving few more days or one more week or something helps, we may do that. But we will start the process of those who already submitted, contacting them and scheduling interviews with them and things like that. That week after that.
Thank you.
Right, so those April time period is when we are meeting with people, and we try to make a decision by end of April, early May. We finalize which organizations we are working with and who are the students we're going to recruit. We're trying to make a final decision on. So we'll be talking with you guys. We'll be talking with those students who have submitted their internship applications all through in April. More than 200 people apply for the internship wise across the mostly people in Florida, but people would apply from other places too. Yeah, so it's quite a lot to go through on the intern side. On the project side, we typically will have 5 or 6 submitting, and we end up picking 3, 4 at the end.
All right, thank you.
All right, so if nobody else has any questions, feel free to leave us today, and I'll make sure to get this information to you. And I'll make sure that Dr. Umapathy and Dr. Richard, that their email addresses are available to you in that follow-up email as well. But thank you all for your time today. Appreciate you sharing your projects. It sounds like there's a lot of fascinating things happening in the sector, and we always appreciate hearing that from our members. Any other final thoughts? Drs. Richard or Umapathy?
Yep. So yeah, nothing else. But we all always know that as you work on it, you will have questions. So we just want to encourage you, don't hesitate to contact us.
Yeah,
Thank you
same
so
here.
much.
We're willing to work with you to think through all of the particulars of the application or think about project scoping.